Welcome to Unit 2, Lesson 1 of Principles of Health Science, and today let's look at the history of medicine. So in the history of medicine, there were a lot of historical views, and one of these historical views was called mysticism. And mysticism was the belief that diseases are caused by supernatural powers or spiritual wrongdoings. And this is a time period when a lot of religion was influencing medicine, and this contributed to things like witches and curses and demons, and punishment from gods was considered illness. But scientific discovery changed this. The scientific discoveries influenced people's perceptions of healthcare, and modern medicine replaced theories of mystical forces. And today we'll look at some of those scientific discoveries, but also it's important to understand that ancient cultures such as the Romans, the Chinese, the Greeks, and next we'll look at Egyptians, influenced modern medicine a ton. So first, let's look at Egyptians. The Egyptians were part of the 3000 to 300 BC, and they made advancements in agriculture and science, but they practiced medicine and conducted exams, and these exams were influential because they not only gave a way to the diagnosis and prognosis we still considered heavily today, but they created the first documentation of patient care using hieroglyphics. Now, what is the difference between diagnosis and prognosis that their exams gave way into? Well, diagnosis is the cause of a disease, and the prognosis is the probable outcome of the disease. So if you have an issue stemming from poor lifestyle, then the prognosis would be how will this disease impact your future. And it's important to note that still medicine, while there were lots of advancements in creating prognosis, diagnosis, and creating health records using hieroglyphics, they still believed that medicine is tied to religion a lot. So the priests were doctors to pharaohs, and the Egyptians knew a lot about anatomy, actually. And they learned a lot about anatomy from doing things like embalming. Now, what is embalming? Well, the Egyptians are famous for creating mummies, and embalming is the process by when people used antiseptics to prevent decay. Now, did they know they were antiseptics? Probably not, but they used these different things to prevent the decay of mummies, and they were able to preserve bodies. And research on these mummies, revealed the existence of diseases such as kidney stones and arteriosclerosis, which was later studied. And the medical practices they created were things like enema and wound closure, setting fractures, and the most important one you'll need to know is trampanation. Now, what is trampanation? Well, it's drilling holes into the skull to remove evil spirits. And this again shows us how medicine was really, really tied to religious beliefs or cultural beliefs, and these drilling of holes were done for none other than to remove evil spirits that caused people problems. It was believed to cause problems. And something that is really cool about the Egyptians is that they developed a symbol for pharmacy that's used today, and that is the RX symbol. And it's the Eye of Horus that is the symbol, but it has a story behind it. And Horus was actually a he was a son of Egyptian gods, and he lost his eye when avenging and fighting for his father's death. And so with his lost eye, Thorth, this god of wisdom and healing, magically healed the eye of Horus and gave it back to him. And then Horus was able to use this eye to restore his father back to the world of living. So now this eye of Horus symbol takes a lot of pride in being the meaning for healing and prosperity and being a symbol of abundance and protection and health. And that's why it's used. It was changed. The actual symbol looks like a eye almost. It's an eye, and then there's a few other things coming off of it. And this is how the original symbol looked, but it changed to become this that's used in modern pharmaceutical situations. Now, Egyptians were not the only group that influenced medicine. It was also the Chinese. Now, the Chinese used plants and plant extracts to create medicine, and they advanced the practice of acupuncture. You need to know this. So whenever a question asks you, what is a modern thing that's still done, but it was created by ancient groups, you can say acupuncture, because it's still widely used today to treat neural issues, all types of issues, and it's the strategic insertion of needles into the body to treat pain and disease, and it's used a lot today. And then the Chinese looked at pulse. Now, pulse was the means of diagnosis for the Chinese, and they believed that characteristics of the pulse, such as the rate, the strength, and the regularity, were the determining cause of the severity or whatever illness somebody had. Now let's look at the Greeks. The Greeks created a lot of things, but they realized that illness came from a lack of sanitation. And so in response to this, they created aqueducts, which brought in clean water and reduced the contamination of water. Now, it's important to understand that the Greeks didn't understand germs and transmission very well. They just thought that being dirty causes issues. Now, they also developed the four humors theory that we'll talk about shortly, and they developed symbols of modern medicine called the caduceus, which is the symbol of peace, and it was carried by Hermes, and it's the modern medical symbol. And the staff of Asclepius represents the star of life that's on your ambulances, so it is the EMT symbol. And now let's look at the four humors theory. The four humors theory is called humorism, and it's the belief that the body is composed of four humors, or four fluids: blood, phlegm, yellow bile, and black bile. And the balance of these four humors is what causes disease or what allows someone to be healthy. And this gave way into bloodletting, which is a huge thing back in the day, and people would let out different substances like blood or bile to heal people. And this was actually something developed by Hippocrates, or at least believed by Hippocrates for a time. And let's talk more about who Hippocrates is. Hippocrates was the father of Western medicine, and he separated medicine from religion. So he said that medicine is not religion. And he believed that diseases were caused by external factors and wrote the Hippocratic Oath, which is still practiced and said by new doctors, and it upholds to the honest and ethical practices you need to do in the medical profession. And one part of this is do no harm. And so even if you can't do good, just don't do harm. And then somebody else you need to look at is the Glenn, who was one of the greatest surgeons in the ancient world, and he performed brain and eye surgeries and used animal dissections to understand the body. But he's never tested, so you probably don't need to know him. And then let's look at the Romans. So the Romans organized medicine. That is a big part of what the Romans did, but they also created the first hospital, and they developed surgical instruments like the forceps, scalpels, and surgical needle. And they created combat medicine for the Roman soldiers and armies. And they further enhanced public health by emphasizing hygiene and sanitation. Now let's look at some ages of medicine. Let's look at the Dark and Middle Ages. So the Dark Ages were when the Roman Empire fell, and this led to a lot of belief that was already present, but it further enhanced the belief that death was caused in the God's hands, right? That God causes death, and prayer was actually the method of healing. And then the plague was a part of the Dark Ages of medicine. And while they didn't discover a lot, they did discover that transmission of illness can cause problems, and they implemented things like quarantine to prevent the spread of the plague and a lot of things. Now let's continue. Now the Middle Age of medicine was slightly better because the Islamic civilization began to advance as leaders in medical science. So our Arabic physicians established hospitals and developed specialties like ophthalmology and pharmacology, and formal training began, and physicians had to become licensed to practice medicine. Now, while there were some good things, there were the invention of barber surgeons, and these were people who obviously cut hair, but they practiced surgery, dentistry, bloodletting, and even amputations. And they have these poles outside their surgeon homes, which were red, white, and blue. You might have seen them in certain movies or pictures. They're the barber poles, and the red represents blood, the white represents bandages, and the blue represented veins. And bloodletting was so common in the 18th century and was likely even the cause of death for George Washington. And it was brought to America with the Mayflower, but it became really popular in the 18th century. Let's look at the Renaissance period of medicine, and this is from 1400 to 1650 AD, and it's a time of rebirth for medicine. So a lot of advancement happened in the Renaissance period, and it was the golden age for medicine, or a second golden age. And it's when a lot of medical universities were created and a lot of training started happening. And some important inventions beyond just medical schools were the printing press and production of books. Now, the printing press had a lot of impact on medicine because it was able to produce books that helped spread medical information and medical discoveries. And an important person during this time was Leonardo da Vinci, and his drawings of detailed anatomical people were used to understand medicine, but later on. But at this time, they were just drawn and they weren't published until centuries later. So that is the Renaissance period. Now, there are a lot of people that you'll need to know and their contributions to medicine, and it's going to look like a lot, and you'll need to know all of them because you'll have a quiz over them. But the first person is Andreas Vesalius, or however you say his name, and he made the first anatomical book. And this book was called De Humani Corporis Fabrica, or in English, the fabric of the human body. And these are all 16th and 17th century people. And the next person is William Harvey, and he discovered the circulation of blood through the body, and it's pumped by the heart. So William Harvey did circulation. And then Anton van Leeuwenhoek, you might remember from biology, but he discovered the microscope that allowed us to see microorganisms that were never seen before, like red blood cells and bacteria and certain yeasts. And he created a lens that magnified up to 270x. And Gabriel Fallopian, as his name suggests, he discovered the fallopian tube. And Bartholomew Eustachius discovered the ear tube, or the eustachian tube, part of the middle ear that has a lot of impact on pressure in the head and some impact on balance for people. So I said fallopian tube, and then I didn't write eustachian tube, but it's an ear tube. And then Edward Jenner discovered that cowpox, people who are exposed to cowpox are immune to smallpox. So he created the smallpox virus from the smallpox vaccine from that information, not the virus. And then Joseph Priestley discovered oxygen, and he invented soda water. And then Benjamin Franklin obviously discovered electricity, but he also discovered bifocal lenses to help with presbyopia, or that is age-related farsightedness, so people can't see things that are close to them as they get older. So he created a lens to help them. And he created the first flexible urinary catheter to help his brother with kidney stone problems. And then we have René Laennec, who was a French physician and invented the stethoscope so he can hear chest sounds. Ignaz Semmelweis, or however you say his name, was an obstetrician, and he discovered childbed fever and how hand washing can reduce the impact and the maternal mortality rate for hygiene. So he basically, everyone thought he was crazy, but he basically encouraged the use of Clorox or bleach to wash hands when delivering babies. And then we have Louis Pasteur, who discovered pasteurization, as his name suggests, and then he discovered the germ theory, which suggested that he discovered germs, but everyone thought he was crazy. And his pasteurization thing is when you heat stuff up, so it kills bacteria, and his germ thing is that microorganisms cause disease. Now, Joseph Lister invented antiseptics for cleaning wounds and for cleaning the air. So he discovered the carbolic acid steam, which is given off into ORs to clean the air and make it sanitary and sterile. And he discovered the first antiseptic, and a good way to remember this is Listerine gets its name from Leicester, but yeah, Listerine cleans things. It's the mouthwash. So, and then we have Robert Koch, or however you say it. But he was the father of microbiology, and he discovered that pathogens cause disease and discovered causative agents of anthrax and tuberculosis. Now we have 19th century women. This is Florence Nightingale, which is the person who created the first secular nursing school, which means that the nursing school does not tie into religion. And this was the first secular nursing school of the entire world. And she also reduced mortality of war soldiers through hygiene. And she was known as the Lady with the Lamp and the founder of modern nursing. Now, she was called the Lady with the Lamp because she aided during war times, but she would have a lamp to go places. So that was why she's called Lady with the Lamp. And then Elizabeth Blackwell was the first woman to graduate with a medical degree and practice as a physician in the US, and her sister with her founded the Women's Medical College in New York. Clara Barton, you should probably know this from 8th grade history, but she founded the American Red Cross and cared for soldiers during the Civil War and gathered supplies for them. Now we have William Röntgen, who invented the X-ray by accident, and the first X-ray was of his wife's hand. And then Paul Ehrlich studied immunity and the effects of antibodies and developed an anti-serum for diphtheria. So a cure for diphtheria. And then Alexander Fleming discovered penicillin. Now, your teacher's probably going to ask you, what's the most important discovery that happened with what we talked about in the history of medicine, right? You're probably going to want to say penicillin because it's the antibiotic that saved a ton of people. So Alexander Fleming and his penicillin are very, very important, and it was derived from mold. Jonas Salk created the first successful dead polio vaccine. So the first polio vaccine, but it was dead. And Salk also refused to patent it or charge for it so it could be distributed very widespread and rapidly across the US. And this was part of the a penny for polio, all of that stuff that happened, or a dime for polio or something like that. But then there was Alfred Sabin, who created the first live polio vaccine that was administered orally, and it was more effective at preventing polio and lasted longer. Now, there was a lot of controversy between which polio vaccine was better, which one is actually causing problems, because sometimes Sabin's vaccines might cause people to have polio or something like that. So there was a lot of controversy. You don't need to know that, but it's an interesting situation. And then this last thing, Perry and Mary Curie or whatever coined the term radioactive, and some of her things she wrote are still very, very radioactive. Now, Best and Banting discovered insulin to treat diabetes, and they studied it on dogs. And then the DNA controversy of who discovered it first. Well, Rosalind Franklin, you're going to learn about this in bio, but identified and took x-rays of double helix structures of DNA. And then Watson Crick and this other guy also studied DNA and were the first to publish these findings that Rosanna Franklin did. So they were credited for it, but later people found out that it was actually their assistant, who was Franklin, who discovered it instead. So you'll learn more about that in bio, but that's cool to consider. And then what are some innovations? Well, we have the PET or PET scan, that is the positive emission tomography, and it was developed by Michael E. Phelps, and it's to detect cancer. And the HPV vaccine was discovered by Ian Fraser, and it's to prevent cervical cancer in women and to possibly prevent other types of cancer caused by HPV. And then there are hypothermia protocols that are used to cool the body to preserve function and prevent damage. And this is used for cardiac arrests or newborn birth asphyxia, which is newborn, like basically lack of oxygen, so suffocation. And then lab-grown organs are organs that are discovered from stem cells. So they're grown in labs from these stem cells, and you'll learn a lot about this in bio, but now we're able to take human cells, human DNA, and put it into other organs like pigs and grow organs from stem cells. So a very important part of medicine now, and we can even grow body parts like noses, ears, and brains in petri dishes. So that is really cool. I honestly think that the history of medicine, the first part, is very, very boring, least enjoyed unit of this class. So if you don't really think this is interesting, I'm with you. But these last final discoveries are some really cool things that you'll learn about a lot in biology. So that is history of medicine.